in place next week when 27 regions begin reopening. We'll have more on this announcement. That's just ahead. A 14-year-old girl in hospital this afternoon after she was shot overnight. We'll bring you an update on this investigation. And bitterly cold temperatures for the next couple of days with some scattered flurries expected. We'll have a look at your full forecast. It is 3 o'clock -9 from 299 Queen Street West. This is Toronto's breaking news, CP24. Hello, I'm Courtney Heels. Has announced details about the reopening plan for 27 regions across the province next week. As of February the 16th at 12:01 a.m., Niagara moves to gray lockdown, while Hamilton, Halton, Durham, Simcoe, Muskoka all move into red control. The province is extending the stay-at-home order for North Bay until at least February 22nd, along with Toronto, York, and Peel.
Right now, when we're opening up cautiously, it's not a wide open, rah, 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 let's go party. Where there's a lot of areas, Toronto still in lockdown gray, Peel still in lockdown in gray, York still in lockdown in gray. And folks, please stay home. Please don't be traveling. Please do not have people over to the house. By no means is this wide open. We have to be cautious, super, super cautious. We saw what happened before, and we don't want it to happen again.
Meanwhile, the NDP leader, Andrew Horwath, says the province is moving too quickly to reopen.
The stay-at-home order needs to stay in place for the entire province. I mean, let's not wait until the variants have taken hold and then we have to put a sudden break on everything. I mean, now is the time to build on the hard work that people have already done in these last number of weeks and hold the line. I mean, let's just buckle in and you know, at some point, some of the regions might be able to move out of the stay-at-home order, but at this point in time, based on the science, on what we saw yesterday, I would strongly urge Doug Ford to change tracks.
The federal government has updated Canada's border restrictions and hotel quarantine rules. As of February the 22nd, air travelers will have to book a 3-night stay in a hotel for quarantine upon arrival at their own cost, with few exceptions. Those arriving in Canada by air prior must show proof of a negative COVID-19 test prior to boarding their flight, and another COVID-19 test has to be taken upon arrival. There are some changes to travelers arriving by land, but a mandatory hotel quarantine is not included.
Starting today, people returning by land borders will also need to show proof of a negative PCR test taken within 72 hours before arrival. And all returning travelers must quarantine for 14 days after coming home or risk heavy fines and possible jail time.
Michelle Rempel-Garner, the shadow critic for health, has sent Patty Hajdu, the health minister, a letter saying, hey, what kind of training are these people getting? Because, you know, as one of my colleagues, Omar Sachdina, reported on, talked to people who are now in hotel quarantines because they didn't have the right PCR test. And some described the event as pretty much not being told what was going on, being put in a van and not being told where they're going, and then told not to tell anybody where they were.
Right now, the period of quarantine is 14 days, and we know that that's really important. We started some pilots with Alberta, for example, Ontario, and others. And so that's the data that we have to look at. With the variants in the mix, I have to say that is sort of it's thrown us another challenge. We want to make sure we know what the behavior of those variants are in relationship to, you know, when the quarantine period is the most suitable, given that they might behave differently.
These changes are in addition to the mandatory 14-day quarantine that is already in place for those arriving in Canada. So we mentioned 27 public health units in Ontario will see some restrictions lifted on Tuesday. For more on this announcement, let's bring in CP24's Nick Dixon. Nick.
Courtney, thanks so much. And to talk more about that, we're going to bring in Dr. Michael Warner, the Director of Critical Care from Michael Garron Hospital. Dr. Warner, thanks for being here this afternoon.
Thanks for having me, Nick.
Okay, before we start this conversation, Dr. Warner, I want to play a kind of remarkable exchange from yesterday's modeling presentation between Adelstein Brown and a reporter asking about the presentation Brown had given and then the conclusion the reporter drew. I want you to listen, and then we'll talk about this afterwards. Let's play this tape now.
am I missing something here, or is this presentation actually predicting a disaster?
No, I don't think you're missing anything. The cases will likely rise given the variants of concern. The need to keep that R down is really, really critical. But there are a number of things that need to be weighed in making these decisions.
Co-chair of the science team acknowledges that the presentation effectively was predicting a disaster. What is your take on what you saw there and fallout from that?
Well, Dr. Brown is right. I mean, we are at an inflection point in the pandemic where when the variants take hold, if cases remain high, we will be in major trouble. And the economic reopening that the Premier has proposed and plans on implementing may have to be rolled back. It may be more difficult to keep schools open if cases get out of control. And the difference between what Dr. Brown was saying and what Dr. Williams has decided couldn't be more stark.
Right. I mean, at the end of that presentation, or one of the things in the presentation was, but by the end of March, we could be seeing perhaps 5,000 new cases daily of COVID each day based on the fact that the variant is going to sort of take over and be dominant. What is that going to mean for somebody like you who runs an ICU and for ICUs across the province and hospitals? When you see that kind of number, there is a definite trickle-down effect into ICUs.
Well, just overall, as a citizen of Ontario, this whole thing doesn't make any sense to me, Nick. I'll just be specific here. So on February 16th, we're going to be opening schools in Toronto, York, and Peel. And on that same day, the regions adjacent to those regions, Durham, Simcoe, Halton, will all be open for indoor dining, gyms, casinos, bingo halls. How does that make any sense if we're trying to make sure that school reopening is safe? How is the government going to know at all whether changes in case counts are related to school reopening or fast reopening of the economy? They won't. And then we'll be stuck. This whole thing doesn't make any sense. And in the hospital, we have a little bit of breathing room right now. ICU numbers are down. It's fantastic. Hospitalizations are down. We might be able to start attacking the backlog of thousands and thousands of procedures that are on the books that need to be done. But now, when we have this opportunity, what the Premier's doing is he's making it much more likely that we're going to be back to where we started at the beginning of Wave 2. I think it's an irresponsible decision.
And what's pretty remarkable is if you take a look at the critical care summary of Wave 1 to Wave 2, in Wave 2, the ICUs were fuller. It seemed like hospitals, doctors, nurses were working almost twice as hard to keep people alive. But even in that situation, more people died.
Well, we've learned a lot about COVID, and I think we're better at treating it. But as you mentioned, we've cared for twice as many patients in Wave 2 compared to Wave 1 in the exact same number of days, 165 days. And almost twice as many people have died because the numbers are twice as high. And, you know, the healthcare workers, people talk about the healthcare system, but we can't forget that there's actually people who work within the system and patients who need the system. It's not some inanimate object that you can throw money at. It's something that needs to work, and the people within it need to be cared for, need to have energy, need to have some gas in the tank. And the hope that I had that we were going to have a little bit of light has been vanquished by this announcement by the government. It doesn't make sense. We just need 2 to 4 weeks to see whether the variants take hold and whether school reopening is safe. After that, we can start talking about reopening the economy. More vulnerable people will be vaccinated by then. But to do it now doesn't make any sense. And I challenge any scientist to say publicly that it does make sense, because I haven't been able to encounter one, an epidemiologist or infectious disease doctor who thinks this plan makes sense. Dr. Williams, I think, is alone here.
Okay, one of the things you and I have spoken a lot about over the last, I guess now it's probably 10 months or so, is testing. You've been advocating for, testing in schools, rapid testing, more testing, that sort of thing. I was listening into a technical briefing earlier today where they were talking about, increasing that rapid testing capacity, pushing them out more, testing more at schools. Is rapid testing going to be something that could help here as they do try to reopen, sort of in an encompassing bigger picture thing? If you get the rapid testing as you reopen schools and hot zones, as you gradually reopen the economy, rapid testing, is that going to help, or is that not going to be nearly enough based on what we have?
I think more testing will be helpful, but once you have positive cases and those cases are already in the community, it's already too late. And the devil's in the details. So, if we have rapid tests, how are they exactly going to be deployed? When? How frequently? There's 4,800 schools in Ontario. Do they have enough tests to make sure that hot zone schools have access to these on a routine basis? Who's going to follow up on the positive tests as they come up? And will we have genomics on these tests? Will these be just, a diagnostic test that says you have COVID, but maybe not say whether you have the variant or not, at least at the beginning? So the details are what matters. But Nick, I think we have an opportunity here. We've done so well, and we just need a little bit more time. Get a few more people vaccinated. All the long-term care home, retirement home residents, get them done. Get paid sick leave for the essential workers who are sitting in my ICU right now. Let the healthcare system catch up a little bit. And then we will be able to evaluate whether school reopening has been safe in high population regions. And then we can go from there in a safe and sustainable way. To do things now is a mistake.
Okay.